Well, thanks for joining us. You're watching Focus on Africa. I'm Wahiga Mwaura. In the last couple of hours, Kenyan doctors have called off their almost 2-month-long strike. Well, it's after the doctors' union signed a return-to-work agreement with the Kenyan government. Amongst other things, doctors were demanding better pay and fairer working conditions. The government had previously insisted that it had no money to honor a binding labor agreement that was signed in 2017. But for the 56 days that the strike went on for, patients depending on public health facilities suffered crippling delays. Our health correspondent, Dorcas Wangira, sent in this report from Mombasa before today's agreement was reached.
These parents are heartbroken. They have lost their youngest child. She was 10 months old.
If this strike was not been there, I could be still with my daughter. Even if she could be in the hospital, at least I could be seeing her breathing, smiling.
Hidayah was diagnosed with pneumonia at the Coast General Hospital in the coastal town of Mombasa.
We had to come back because of the strike at home. So she never received any kind of medication. And by the time we were referred to the ICU, she died on the way.
Hospitals are supposed to provide minimal care during strikes. The region's Union Secretary General says no one should be denied care.
I am sorry. My sympathies goes out to the mother for losing her baby. This news has shocked me. Since the strike began, minimal services have been offered at Coast General Hospital. Whoever had a dire emergency will be treated. They will not be turned away. We don't just stand by and watch as people die. For the doctors that are on strike, they should remain on strike. For the ones who are offering minimal services, you continue offering minimal services.
The BBC contacted the Coast General Hospital about the claims made by Hidayah's parents, but they did not respond.
Every Kenyan has the right to the highest attainable standard of healthcare, and that includes emergency care and maternity services. However, in the event of a strike or industrial action, it becomes very difficult to attain that. Hospitals such as this one under the county administration have had to resort to contract doctors to fill the gap of doctors who are on strike.
Coast General Hospital is managed by the county government of Mombasa. The governor feels they're doing enough to offer care.
We've got babies being born, we've got people being treated. Has the strike affected us? Of course it has affected us. But the fact that we also have others who are not necessarily in the union means that we can be able to do what needs to be done.
This is not the first time that Kenyan doctors are going on strike over pay. The longest strike of 100 days was in 2017. Across the continent, healthcare workers have downed tools over pay and working conditions in countries like Zimbabwe, Nigeria, South Africa and Ghana. The current deadlock in Kenya is the government's stance that they lack funds to honor the agreement that ended the 2017 strike. It was to pay $1,500 a month to intern doctors, but now says it can only pay $500. But for those impacted like Hidayah's family, their only hope is that the doctors and the government can reach an agreement soon. Dorcas Wangira, BBC News, Mombasa, Kenya.